Hello, my name is Dr. Christopher Anderson.
And I'm Dr. Joel DeCastro.
We are urologic oncologists who specialize in prostate cancer and would like to provide you with information about having a radical prostatectomy at Columbia University Irving Medical Center, New York Presbyterian Hospital.
We will explain what to expect before and after surgery and introduce you to the team that will help care for you throughout this period.
We perform nearly all radical prostatectomies using a robotic-assisted approach utilizing a state-of-the-art Da Vinci robot. By using small incisions, this technology makes postoperative recovery easier compared to open surgery.
A nurse in the preoperative care unit at New York Presbyterian Hospital will contact you the business day prior to your procedure with details about when to arrive, where to go, and other important things you should and should not do before your procedure.
After a robotic prostatectomy, patients typically spend one night in the hospital and are discharged home the next day when they are able to walk, eat and drink regular food, and have any surgical pain controllable with oral medications.
Patients are discharged with a catheter to keep the bladder empty. During your hospital stay, the nursing staff will teach you how to care for your catheter and ensure that you are comfortable caring for it at the time of discharge.
7 to 10 days after surgery, you will return to our office for a postoperative visit. During this visit, we will remove your catheter and review the pathology results from surgery. You can call our office to arrange this visit.
Here at Columbia, we have a world-class team to help patients through their prostatectomy. I'd like to introduce one of our nurses, Bernadette Pena, who will teach you about what to expect during the first week after surgery.
Hello, my name is Bernadette Pena. I'm a registered nurse at New York Presbyterian Hospital, Columbia Medical Center. After surgery, your nurse will show you how to connect your bladder catheter to 2 different drainage bags, one for the use at night and one for the day. At home, you may exchange the 2 drainage bags as needed. Remember to keep the large drainage bags below the waistline to prevent backflow. You can clean the drainage bags between use with 1 part vinegar and 3 parts water, and then allow to air dry. At discharge, a stabilization device will secure the catheter to your inner thigh to prevent the catheter from being pulled. If at any time this device falls off or breaks, you should secure the catheter in a similar fashion using medical tape. A liquid skin adhesive is placed over each surgical incision, which will fall off on its own in 2 to 3 weeks. There are no stitches to remove, and it is not necessary to use any creams or ointments on the incision. Pain around the incision is normal. We recommend Tylenol and ibuprofen for incisional pain, unless you are unable to take one of these medications. You may take showers and wet the incision and the catheter. However, avoid baths until your catheter is removed and your incisions are fully healed. After hospital discharge, we encourage you to walk regularly. You may go up and down stairs, but do not lift anything over 10 pounds. Stay well hydrated and eat a balanced diet. Now please, let me introduce Stephanie Goodwin to discuss pelvic floor physical therapy.
My name is Stephanie Goodwin, and I'm a pelvic floor rehabilitation specialist at New York Presbyterian Hospital. After prostatectomy, men can experience leakage of urine, often due to weakness of the muscles that support the bladder and pelvic floor. Exercises to strengthen the pelvic floor muscles, known as Kegels, can help reduce urinary leakage. Once your catheter has been removed, you should start doing pelvic floor exercises. The muscle that controls your urinary stream is closely linked with the muscle that controls your anus, and contracting one causes both to contract. You contract the pelvic floor muscles when you try to stop your urine midstream or when you hold back gas. You should feel a lift of your penis and testicles up towards your pelvis. If you are having a difficult time locating the right muscles, you can use a mirror to see your pelvic floor muscles lift or place a hand on the outside of your anus to feel it close. You should tighten these muscles without using your thighs, buttocks, or abdominal muscles, and without holding your breath. You do not have to change clothes to do pelvic floor exercises, and you do not need any special equipment. Start by contracting the pelvic floor muscles for 3 to 5 seconds and gradually work up to 10 seconds as your muscles become stronger. Make sure your bladder is empty when you do Kegels, and you fully relax your pelvic floor muscles after each contraction. Perform 10 contractions 3 times a day. You can start doing these exercises lying down and progress to sitting and standing when you feel stronger. It can take anywhere from 6 to 12 weeks to fully strengthen your pelvic floor muscles. Some patients will see improvement in their urinary symptoms sooner, depending on how quickly they heal and how consistently they are doing Kegel exercises. If you have difficulty doing these exercises or have persistent leakage despite doing these exercises for several months, ask your surgeon about a referral to see a pelvic floor physical therapist. And now let me introduce Diana Goldberg and Dr. Joseph Alukal to discuss sexual health.
Hi, I'm Dr. Joe Alukal.
And I'm Diana Goldberg. We're the core of the men's health team here at Columbia University Department of Urology.
We are here to talk about sexual problems that can occur after prostate cancer surgery. Although not all men experience these problems, this is understandably something that many men are worried about. Rest assured that if you develop difficulties with your sexual function after prostate cancer treatment, there will be a solution for you.
Erectile dysfunction is a common side effect of prostate cancer treatment, often due to injury to the nerve fibers next to the prostate that allow a man to get an erection. For men worried about erectile function after prostate cancer treatment, we first assess how your function is before treatment. If a patient has pre-existing erectile dysfunction, we assess the severity and may ask you to trial an oral medication to treat erectile dysfunction before surgery. In addition, you should optimize your physical health with weight loss, diet, exercise, and smoking cessation. This can help both with sexual function as well as recovery from the procedure in general.
Most patients will be seen by our men's health team several months after surgery. At that time, we will assess your erectile function, educate you about treatment options, and determine your future goals. Many patients are started on oral medications early after surgery, such as Viagra or Cialis. If appropriate, we will discuss other treatments that can restore erectile function, such as a vacuum device, penile injections, or even a penile implant surgery. Our goal is to identify the best treatment plan for each patient.
After a prostatectomy, you should anticipate not having any ejaculate. You will still be able to have an orgasm, although no fluid will come out.
Fertility can be a problem after prostate cancer treatment, therefore. If future fertility is important, we can discuss options before you start your treatment. If you have already been treated for prostate cancer and experience infertility, we do have many options to help you.
Throughout the first 2 or 3 years after surgery, you will check back with us periodically. If at any time you would like to discuss additional treatments for your sexual health, we are always available.
We look forward to meeting you and are confident we can help you meet your sexual function goals. Contact Men's Health at CUIMC.columbia.edu with any questions.
Please let me introduce Anthony Lutz to discuss prostate cancer survivorship.
My name is Anthony Lutz, and I am a nurse practitioner here at the Columbia University Department of Urology, and I run our cancer survivorship program. After you complete the prostate cancer treatment phase, you will transition into our survivorship program. Cancer survivorship care includes management of not only treatment-related symptoms, but also surveillance for cancer recurrence, screening for second primary cancers, and the promotion of overall health and well-being. Prostate cancer survivors face many unique needs that we address during survivorship care. Specifically, patients treated for prostate cancer are at risk for urinary, bowel, and sexual side effects. Our survivorship program is designed to identify and treat any treatment side effects, sometimes in conjunction with other specialists. We follow the comprehensive prostate cancer survivorship guidelines set forth by the American Cancer Society and create an individualized survivorship care plan for each patient. I work closely with the other members of our prostate cancer team to ensure that your survivorship goals are met and your health and quality of life are optimized after prostate cancer treatment. I look forward to supporting you through your journey as a prostate cancer survivor.
We hope this video provided you more information about our prostatectomy program and answered any questions.
Our team is poised to deliver comprehensive prostate cancer care and is committed to helping you have the best possible surgical outcome.
Thank you for your interest in our program. For more information, please visit us at www.columbiaurology.org. For appointments, call 212-305-0114.